Hi guys, my name is Amatullah and my disease is Cryptococcosis. So a little bit on the history of Cryptococcosis. The genus Cryptococcus, from the Greek word cryptis, meaning hidden, was first created by Kutzing in 1833 for a group of yeasts that lacked the ability to produce endospores. The first published information about Cryptococcosis was reported in 1894 by Otto Boos, in which he correctly identified the characteristics and symptoms of the disease, which was then termed Boos-Busch disease, but findings published subsequently in 1895 by Sanfelice gave this fungus its name. 1935, Benham classified 22 strains of Cryptococci and used previous cultures made by Boos, Busch, and Curtis and put them all under one genus, Cryptococcus. 1952, the fungal pathogen received its name C. neoformans, and 1975 to 1976, the life cycle of the yeast was determined. But 25 to 30 years later, in 2003, the two different species were determined, C. neoformans and C. gatae, secondary to different sexual structures. Okay, so as for the outbreaks are separated into three parts. 1978 was the first major outbreak. The frequency of cryptococcosis rose with an enlarging immunosuppressing population as a result of advanced medical therapies for serious underlying diseases increased, like medical programs and organ transplantation, aggressive treatments of cancers and connective tissue diseases. The second major outbreak was in the mid-1980s with the immunosuppressed HIV pandemic. The number of cryptococcal cases were estimated at 1 million per year worldwide, and there was an estimation that more than 600,000 deaths occurred at the peak of the HIV pandemic. The third major outbreak was in year 2000 in the Pacific Northwest, secondary to C. gatae infections. This outbreak challenged the understanding of the new recombinant strains and of the potential influences of climate on changed fungal ecology. Okay, so the major causes of cryptococcosis are infection by C. neoformans and C. gatae, which are the species for the genus Cryptococcus. These aren't the only species, but these are the two major ones that cause cryptococcosis. These two species have several serotypes of different capsular polysaccharides that cause the majority of human cryptococcosis. The three strains of C. gatae that are most frequently found causing cryptococcosis are VG2A, VG2B, and VG2C. Cryptococcus was originally thought to occur only as a yeast, but is now considered to have a mycelial form. The polysaccharide capsule, which is shown in this picture above, the blue surrounding is the polysaccharide capsule. This covering of the yeast form renders Cryptococcus species resistant to human and animal immune defenses. The fungi do not usually cause major problems during the initial infection, but they slowly multiply. The organ damage begins to occur when the fungi develop fungal masses, cryptococcomas, that start to compress the involving organ, so like usually the lung or the brain. Some of these fungi can separate from a lung or fungal mass and be carried by cells or swept into the bloodstream, which then lodge or grow into other organs, like especially the brain. Many patients may show no symptoms related to lung infections during this process because there is little to no inflammatory response to these organisms. Symptoms do not develop in human and animals until late in the disease process, when the fungal mass begins to alter the organ where it is located. So that's why some individuals show brain changes as the first symptoms of having cryptococcosis. As for the incubation period, for C. neoformans, it's quite uncertain because the organism is everywhere, and it's often impossible to determine when the person was exposed to this. But some clinical cases can occur months to years after exposure. As for C. gatae organism, based on the Vancouver Island outbreak, they have a distinctive molecular type, which has allowed the incubation period to be determined by the visitors on the island. The illnesses caused have appeared between 6 weeks to 13 months after exposure, with an estimated incubation period of 6 to 7 months. As for risk factors caused by C. neoformans are inhalation of the fungi that are associated with various bird droppings or guano, especially from pigeons. People who are immunocompromised, especially those with HIV/AIDS or have cancer or on chemotherapy, are the more susceptible to acquire this infection. Risk factors caused by C. gatti, on the other hand, are different. In general, these infections were mainly associated with tropical, semi-tropical climates around the world, and most frequently associated with inhalation of plant propagals, especially those from the eucalyptus, red gum, or forest red gum trees. However, C. gatti is capable of inhabiting other areas. Like in 1999, there was cases of C. gatti noted in animals, like cats, dogs, or ferrets, or marine animals, and a few individuals in Vancouver Island. In 2006, an outbreak cases over 100 with at least 6 deaths occurred in Vancouver Island, and since that time, other cases have been found in Washington and Oregon. C. gatti has been isolated from plant debris, dust, air samples, and usually near strands of trees or logging areas in the Pacific Northwest. Some people suggest that C. gatti was imported with semi-tropical vegetation, which was released into the environment and has begun to adapt and grow in the Northwest states. Consequently, a risk factor occurs when people encounter airborne propagals or dust, especially around logging time, and only recently have developed tests to distinguish C. gatti from C. neoformans, which have been said that apparently the previously attributed to C. neoformans were actually caused by C. gatti. Other people speculate that the more virulent strains of C. gatti have evolved and are now being noticed by the medical community. Some researchers suggest that the first sign that cryptococcosis is in the area is increased diagnosis of the disease in animals, especially domestic pets. Although animals do not pass disease to humans, or humans don't pass it to humans either, the disease indicates a likely chance of exposure of humans to Cryptococcus. People with lung or CNS problems, central nervous system problems, who have visited or inhabited the areas where animals have acquired the infection are required to be tested for the disease. Majority of the symptoms occur in either lungs or brains or both. This is the following list of the major symptoms. Pleuritic chest pain is a sharp pain that occurs over the ear inflammation and increases with breathing movement. Hemoptysis is bloody or bloody tinged sputum. By vision changes, I mean blurry or double vision or photophobia. Mental status changes is like lethargy or confusion. The medical caregiver should be informed of the possible exposure to Cryptococcus if the individual knows they have been in the area where Cryptococcosis has been diagnosed to either domestic pets or people. This will actually help the medical provider give additional tests. Even if the patient has some visible findings like skin lesions or even pulmonary bone lesions seen on x-rays, many other diseases like histoplasmosis, toxoplasmosis, TB may also have these findings. A CT scan or MRI of the brain may show focal areas of possible infection in the brain, but again, other diseases may show similar findings. However, serological testing of the spinal fluid obtained by spinal puncture and blood may provide presumptive evidence of cryptococcosis if the person has symptoms. Definitive diagnosis depends on isolating the fungus from the infected patient's tissue or bodily fluids by biopsy samples. Further testing, it's like you can do PCR testing, which is shown in the picture on the very left, which tests for genetic material and can identify if the infection is caused by C. gatti or C. neoformans. For the treatment, the treatment depends on the patient's overall condition, like HIV/AIDS, immunocompetent, having brain lesions or pulmonary lesions, or both, or the extent of the infections, like single organ involvement or multiple organ involvement. Most experts suggest that infectious disease specialists should help guide the often long-term treatment with multi-antifungal medications. A few patients may require surgery to remove the cryptococcoma. The goal of the treatment is to eliminate the fungi. However, for some people, this is not possible. So the patients may require lifelong medication to suppress the fungal growth for reactivation. Treatment for C. neoformans and C. gatti are pretty similar. Patients who are not immunocompromised are treated with amphotericin B alone for about 6 to 10 weeks, or combined with flucytosine for about 2 weeks. These treatments for brain and severe lung infections are followed by fluconazole treatment for at least 10 additional weeks. Antifungal therapies usually extend until spinal fluid test is negative in patients with brain infections, and the lung and mild infections in the lung may resolve without treatment, but they must be monitored to make sure reactivation does not occur. For immunocompromised patients, they're treated the same as above, but they're started off with IV drugs. And the length of treatment may range between 1 to 2 years or maybe even a lifelong suppressive therapy, usually with fluconazole. Regular medical checkups are required or highly strained to go to determine if this disease has reactivated or lesions have increased in size. An additional thing they can do is a consultation with an expert in infectious diseases, because they have they are aware of any new treatments or protocol changes that may develop with the ongoing research that may benefit the patient. Unfortunately, there are no known prevention methods available at this time, but it is suggested that if you plan on visiting the Vancouver/Oregon forest and coastal areas, that you wear a mask or respirator capable of filtering out particles as small as 3 micrometers or 1 micrometer diameter. This is prudent advice, especially for immunocompromised individuals. It is suggested that immunocompromised individuals in the area avoid the forest and coastal areas altogether. But unfortunately, with C. gatti now occurring in the Pacific Northwest, researchers suggest that C. gatti is adapting to survive in this region. Avoiding dust inhalation, especially in dense forests and logging operations, as I said earlier, may help reduce exposure to C. gatti in the Pacific Northwest. And unfortunately, there's no commercially available vaccine to prevent cryptococcosis. As for prognosis, with early diagnosis and treatment, most people with cryptococcosis have a good or excellent prognosis because the infection will be stopped. Those who are diagnosed late in the infectious process, who are immunosuppressed, immunocompromised, have a fair to poor prognosis and may have a mortality rate of at least as high as 30%. And those who have survived or have a relapse or a reactivation rate will have a reactivation rate of at least 25%, while others often have long-term or lifelong requirements for suppression of treatment with antifungal drugs. These are just some of the classifications. These are just the classifications for Seniorformes and C. gatti. As you can see, the kingdom, phylum, class, order, family, and genus, they're all the same. They just differentiate when it comes to species, obviously. And this is probably a little boring for some of y'all, so I just wanted to end it in a fun note. So I thought I would add this picture. But thank you guys for watching. I hope you guys enjoyed this.